Hepatitis C, made simple. Hepatitis C, know your status. You may not have heard much about hepatitis C, but it is more common than HIV. And like HIV, it does not discriminate. If someone is exposed to the virus, they are at risk. In the United States, 4 times as many people are infected with hepatitis C compared to HIV. Signs and symptoms of hepatitis C. Some people with hepatitis C do not experience any symptoms. However, when a person is infected, they may feel tired or have other temporary symptoms. Sometimes, the body can get rid of the virus on its own. If the body isn't able to clear hepatitis C after the initial infection, then the virus goes into the long-term or chronic phase of infection. You never know when hepatitis C will get worse, but the chronic phase is a serious condition that can lead to serious liver diseases like cirrhosis or liver cancer. When the liver is severely damaged, it can't do its job and can lead to liver failure. People with liver failure may experience symptoms like itchiness, confusion, swelling of the belly and feet, and a yellowing of the skin and whites of the eyes, also known as jaundice. By the time these types of symptoms begin, the liver may already have been seriously damaged. If you have any of these symptoms, you should talk to your doctor as soon as possible. These symptoms are a sign that something is wrong, and treatment may be needed. Even if you don't have any symptoms, it's better to know your hepatitis C status so you can take action. How is hepatitis C spread? Hepatitis C is passed from person to person when the blood of someone infected with the virus mixes with the blood of someone else. Before 1992, donated blood products and blood could not be tested for hepatitis C. As a result, some people were accidentally infected after having surgeries or other medical procedures. People who are baby boomers, those who were born between 1946 and 1964, are also at risk. This is because they could have been exposed to hepatitis C when infection rates were higher in the 70s and 80s. Some people may have been infected with hepatitis C from sharing tools used to take drugs, like previously used needles, syringes, cotton, water, or cocaine straws. Other people may have been infected by sharing different tools used on the body. For example, tattoo, piercing, or acupuncture needles need to be safely discarded after each use. Only new needles should be used. Manicure or pedicure tools need to be cleaned and disinfected after each use as well. People working in a medical setting who get stuck by a needle or cut by another sharp instrument may also be exposed to the virus. Rough or anal sex without a condom can also pass on hepatitis C. In fact, any activity where there may be blood-to-blood contact is a risk factor. Who should get tested? If you have one of the risk factors mentioned earlier, you should be tested for hepatitis C. Having one or more of the risk factors in your past does not mean that you definitely have hepatitis C, but it does mean that you have a higher chance of hepatitis C infection. Getting tested. The only way to know for sure if you have hepatitis C is to get tested. The hepatitis C test is not usually part of a routine checkup. If you want to know your hepatitis C status, you need to ask your doctor to test you for the virus. A hepatitis C test may be available at a local public health department or clinic. When you take the hepatitis C test, your blood is checked for hepatitis C antibodies, or proteins that your body makes to fight the virus. The test. The doctor sends a small amount of your blood to the lab, and in about 1 to 2 weeks, the results are sent back. If the test comes back negative, it is unlikely you have hepatitis C infection. If the test comes back positive, it means that you have been infected with hepatitis C, and you need to have further tests to confirm your status. Testing positive. If the test is positive, talk to your doctor about your infection. Ask questions and get educated. It's your body. Together, you and your doctor will decide what the next step should be. There's no telling when or how much your liver may be damaged by the virus. You should talk to your doctor about protecting your liver with healthier choices, better nutrition, and avoiding alcohol. Your doctor will measure the amount of virus in your body with the viral load test and monitor how the virus affects your liver with liver enzyme tests, and if necessary, a liver biopsy. These tests will help you and your doctor make a plan of action. Over time, hepatitis C can cause fibrosis or scarring of the liver, which can progress to cirrhosis. It can even lead to liver cancer, which can be a deadly disease. The good news is, hepatitis C can be cured. It's better to know about hepatitis C so you can talk to your doctor about options. The virus may have found its way into your life, but you can take action to eliminate it. Where can you learn more? To learn more about hepatitis C or watch the rest of this educational video series, go to www.hepc.tv.